Hi, everyone. I hope you're doing well. It's Stephanie with the Patient Story, and I'm so excited to be able to introduce our guest today, Ivy, who not only went through her own lung cancer story, but has become a total advocate and a voice for others. So, Ivy, thank you so much for joining us today.
Thanks for having me on today.
Yeah, it's quite a story to get into. But before we do, I just want to check in with you to see how you're doing, and also for you to just introduce yourself to the folks today.
Sure. Well, I'm doing well, well as I can be given, the whole COVID pandemic limiting some of our activities. But overall, I'm doing very well. Just a little bit about me is I live in the suburbs of Chicago, actually northwest of the city, with my husband, who in about a month and a half, and I will be celebrating having been married for 25 years
Wow,
total.
congratulations.
Yeah, thank you. And I have two boys. One of my sons is 20 years old and is a sophomore in college. And my other son is 18 and is a senior in high school right now.
So almost empty nest.
Yes, we're getting there.
By the way, I went to school outside of Chicago at Northwestern, so I did spend some years there.
Oh, great. Okay, well, that's really not that far from us at all. We like to go over to Evanston for dinner often.
Yeah, I'm a California girl, so it was the only time in my life where I got to witness real seasons, like all four seasons. But absolutely beautiful over there. And again, congrats on 25 years. I'll have to ask you about that for some other story, some tips on that.
Well, thanks.
So Ivy, you were diagnosed with stage 4 lung cancer, EGFR, and we're gonna get right into it. And a lot of, your message today is the message of anyone with lungs can get lung cancer, right?
Mhm. Yeah.
So I'm actually gonna bring up that photo of you. You said it was a month before you got diagnosed. As I
Mhm.
bring it up, could you just start telling us about how you knew something was wrong? What were you feeling? What were those first symptoms?
Sure. Probably around the middle of 2013, I just started having some issues with my right elbow. I couldn't completely straighten it, and it hurt a little bit. And the left side of my neck also was bothering me a bit. And initially, I didn't really think anything of it, but it didn't go away. So I first went to see my primary care physician, who pretty much, kind of took a look at me, said, you know what, you're 47, how have you been using your computer, holding your iPad? And pretty much said to me that he thought it was just an overuse injury. And to be honest, I just completely agreed with him because it seemed like that, totally made sense. I had been active, healthy, never really had any problems before that point. So that made sense. So he sent me to physical therapy and actually did all the right initial things. He had an x-ray he done of my elbow, which showed absolutely nothing wrong, an MRI done of my neck, which showed nothing other than, the typical deterioration that comes with being a little bit older. It was, I think, mildly degenerating discs, something like that. Anyway, um, for about 6 months, though, I went from a stint in physical therapy to visiting an orthopedist and getting a cortisone shot in my elbow and seeing a rheumatologist and another physical therapist. And no one could really figure out why my elbow, which they had deemed tennis elbow at this point, wasn't responding to any of this treatment. My neck, oddly enough, started to feel better, but my elbow didn't. And I eventually ended up at an orthopedist who specialized in the wrist to the shoulder. And he did an MRI of my elbow because he was trying to figure out what was going on and saw that there was a mass in there that was on like the joint and looked like it had actually eaten away a little bit of the bone over there. And he didn't really know exactly what to make of it. So he sent me to an orthopedic oncologist. Now, when I went to the orthopedic oncologist, I mean, I obviously was already terrified because, the word oncologist is in the name. And I went with all my various reports and everything. And when I first saw him, he honestly kind of took a look at me. I looked healthy, good shape, everything. And he said to me, if you presented differently, I would think that this was a metastasis, possibly from somewhere else. But I'm really, really like 95% sure that this is a benign condition called a giant cell growth. And I'm going to do a biopsy, no rush to get that scheduled. We'll go in, take a look at it, and if that's what it is, take it out and you're pretty much good to go.
Right, right,
Well, all that happened, but it wasn't benign.
right, right.
So instead,
Before we
it
go
came
into the
back.
diagnosis, Ivy, actually, I would love to ask you, just because I know it's coming, but you've been through, I mean, we're talking months, so many weeks and
Mhm.
months of visiting multitude of different specialists. If you could just sort of let us in on mentally where you are at this point, before you start to really get the answers. You're trying so hard, nothing's coming forward. How are you feeling, and how do you deal with it?
Yeah, it was interesting. I was actually getting kind of frustrated because I was being really good at following everyone's recommendation for the next doctor. I was doing all my physical therapy exercises. I was, getting my cortisone shot. I was following up and nothing was improving. So I was getting kind of frustrated. But then on the other hand, there was a little piece of me that also kept thinking, do I just keep pushing forward? What if, this is, like my husband and I talked about it and he said, well, how I have problems with my knee, and this is my thing now, I have, a kind of an arthritic knee. I mean, maybe this is, people get older and maybe this is going to be your weak spot. So, I mean, part of me was thinking, how much am I going to keep going to doctors and trying to figure things out? But it just seemed odd, and that the whole elbow thing kept getting worse. It wasn't like it was getting better, and I kind of got to the point where just putting my hands up to wash like the back of my hair hurt. And I was 47 years old. That just didn't seem right. So
Right,
I kind of kept going and was determined to figure out what was going on.
right.
And it took a good 6 months for that to
Right.
happen.
Right. But you listened to your gut. I mean, there was a voice, and also your husband talking about there's some things about getting older, but there was
Mhm.
something you felt from within where you thought, you know what, I need to keep pushing for answers. And so you did. Thank you for bringing us into your mind, Ivy, where you were at that point. So, okay, we'll go back. So you see the orthopedic oncologist. He or she does order a PET scan too.
Right, right. Because when the results came back that it was malignant, it came back as adenocarcinoma. So that's how that doesn't originate in the
Mm,
bone. So
right.
they knew at that point that the cancer I had came from another part of my body.
Interesting.
And I remember asking the orthopedic oncologist, so where does adenocarcinoma come from? And he said either the lungs or the breast. So initially, I was convinced I had breast cancer. I mean, at that point, I had no idea that lung cancer was something that I could get. I, didn't realize, what I know now, that, oh, you need lungs to get lung
Right.
cancer. I didn't think I had any risk factors.
Right. And Ivy, to your point, I mean, and breast cancer is, something we hear a lot about, a lot more
Right.
than lung
Exactly.
cancer, right? So, you had that biopsy of the elbow mass, and then I kind of skipped over to the PET scan. But in between, of course, is when you found this gargantuan, you heard the word. I mean, you finally really realized that the cancer was in play here, right? That the word
Yes.
cancer was. Can you describe two things? First is, we know this as scanxiety, or it can reply to waiting for scan results or any test results. You had that biopsy. Did you experience anxiety as you were waiting for those results? How did you handle it? And then the second thing I'd love to ask is if you could just recount the moment that your oncologist gave you the news about the mass.
I was pretty nervous after I had the biopsy, even though my oncologist at that point had said that he was kind of pretty sure that it wasn't going to be anything, I was still nervous. And it took a good amount of time, it seemed like, before I had results back. It took probably a couple of weeks. I don't remember exactly how long, but the thing that complicated everything a little bit was that I was having all of this done in between Thanksgiving and the winter holidays. So things slowed down. It was hard to get in touch with people. And, just preparing for the holidays myself with, two kids, two young boys who were going to be home, off school. It was just a really, really stressful time.
Right. Actually,
Really
Ivy,
stressful.
the biopsy, could you describe for people what was that procedure like? What did it entail?
It really wasn't, the biopsy itself really wasn't that bad. They didn't put me under general anesthesia. They gave me a twilight drug. So while I was, awake, I wasn't really too concerned about anything that was going on. And the actual procedure was quick. I remember having to put my arm in a certain position and hold it there. And they took the cells that they needed, and after a brief recovery, I just went home. It really wasn't particularly painful afterwards, and
Okay.
it wasn't, it wasn't something that I felt was particularly traumatic.
Okay, that's good. That's really good.
Mhm.
What was harder was, of course, as you described, the wait for however long, over a week, maybe 2 weeks.
Exactly.
Now, if you could bring us to the moment where, I don't know if you got the call or if they told you to come into the office, describe that moment when you heard cancer.
Right. It was actually a call that I received. Well, my oncologist called, and he actually wanted me to come into the office and set up an appointment, but I already knew what he called. It's not good news if an oncologist who already said he thinks 95% chance this is benign tells you he wants you to come into the office to get the news. So I pretty much, convinced him on the phone to tell me what in the world was going on. So that's when I had the conversation about how it was malignant and it was adenocarcinoma. That was over the phone. I have to say that I was just, my stomach dropped. I just was, I don't know if shocked is the right word, because I guess I always knew that there was a possibility, it could be cancerous, but I was just very, very, very shaken by that news. And just, I almost didn't even know like what to do next. It was just, kind of like a nightmare coming true.
Right, right. And it's kind of odd, I'm sure too. On one hand, you were fighting to have an answer. You were frustrated. You didn't have an answer for all these
Mhm.
pains. But on the other hand, of course, that's not the news you want to hear.
Right.
Did you at that moment? So I guess you already explained. You try. It was hard to process the diagnosis.
It was really hard to process.
It was,
Mhm.
yeah, and also you didn't have all the answers quite yet.
Mhm.
At that point, did you break the news to anyone, or did you want to wait until you had more answers? How did you approach that?
I didn't really, my husband was there with me when I found out, because I'm trying to remember whether it was over Thanksgiving break and he was home, but he was home with me when I found out. At that point, didn't tell anyone. I didn't tell my parents. I didn't want to tell anyone yet because I had no idea what it was. I wanted to, get more information about where it came from, and at least have the PET scan, which was the next thing that was scheduled, before I told anyone.
You know
It was
what?
slightly complicated by the fact that my kids were really young, and somebody needed to watch them and kind of get them to school when I went downtown to have early morning appointments. So I do remember telling a couple of friends that I needed to have some tests about my elbow, but I didn't go into detail at that point.
Got it. Because you needed to share some so that they could help out, but you didn't want to
Mhm.
open the can of worms just yet. You wanted more
Exactly.
answers. So let's talk about that. So do you remember how long it took? until you were able to get the PET scan? And can you describe for people who are about to go, to undergo a PET scan, what that's like?
Yeah, I don't think it took that long for me to get the PET scan scheduled. It was within a week. I went in to have the PET scan. But this was sort of the beginning of a whole new language. All of a sudden people were talking about PET scans and and getting contrast injected and other scans that I might need, CT scans, brain MRIs. I mean, it's kind of overwhelming, when you go from just being your normal everyday person to entering kind of the world of oncology. And there's a lot of terminology that you need to learn about. And, you're learning about this at a time that you are at your most vulnerable because you're terrified about what's going on as it is. So it's kind of hard to take all of that in.
Absolutely. And that's where, of course, caregivers are big, play a big role. If you have at least one person you can rely on to be at appointments with you, help you figure out the jargon, that support. We'll definitely talk about caregivers. The actual PET scan itself, how was that? What is it like for people who've never undergone one before?
Okay, so you go in, and before you actually have the physical scan, you need to get an IV in your arm so that they can put in this radioactive, I think it's radioactive contrast material. So that they can see where, in your body, what areas light up that have cancer basically located in those areas. So I remember I went in, I got my IV, I had the contrast injected in the IV, and then you basically have to kind of sit sort of quietly in a room for 45 minutes or so that there's enough time for the contrast to spread throughout your body and kind of get where it all needs to be before you can have the actual scan. Again, that's painless. You don't feel any of that other than the stick of the IV. But, it's again kind of stressful because you're sitting there all by yourself waiting for your scan. Scan itself is, relatively painless too, and doesn't take all that long. You lay down on kind of it almost is like a little stretcher type thing, and go into the machine, and you're scanned. Doesn't even take maybe longer than 30 minutes, I think, and it's done. Right. So, I mean,
okay, yeah.
That was pretty much what the process was.
Yeah, thank you for walking us through that, just human terminology for what the experience is like. And then, of course, the hard part is waiting after the scan. So, of course, that's where they were able to get more information, figure out where the cancer had spread from, the origin. So Ivy, bring us back to the moment when you first heard the full diagnosis and the news and what was going on in your head and your heart.
Well, fortunately, after the PET scan, I didn't have to wait very long to find out the results. I actually found them out the same day while I was still in the hospital. I'm, treated in major medical center downtown Chicago. So it was a quick process. So I remember my husband and I went, got some lunch, and by that time, it was time to get the results of the scan. And, I sat down with the orthopedic oncologist, and he basically told me that they found that from the PET scan, there was some areas in my lung that had lit up, mostly a, almost 3-centimeter mass in my upper right lung. There might be other, small little nodules, but that was the main area. And that they had found that the elbow mass was also, that also lit up. There was an area on my neck where I had the neck pain that lit up, and there were a few other bones that did as well, my rib, my pelvis. So he told me that that was, considered metastatic lung cancer. And the next stage would be for me to talk to a thoracic oncologist. And he actually referred me to someone, and he said he wanted to get someone from that department in the hospital to come in and even speak to me that day. But again, it was over the holidays. My PET scan was on December 26, 2013, and it just wasn't possible to get anyone to talk to me right then because a lot of people were on vacation.
Absolutely. I'm happy to hear that you were able to get the PET scan results same day. And I know it depends on the place where you get this stuff done, but some places, if you can schedule an earlier morning scan, you do have a better chance sometimes of getting a same day result. So that is one thing that I have learned from people. Ivy, that was a lot for you to swallow, of course, at that point, hearing stage 4 lung cancer. Was your husband there with you? Do you remember how you were able to, I don't even know if process is the right word, but once you're hit with that, what was the next step for you? I mean, how were you able to digest this, or were you not able to?
My husband was there with me. To be honest, a lot of it is really a blur. It really is. I mean, I know we went home. I know I pretty much didn't really want to talk to anyone. I know my husband called his family, called my parents, told them, and, it was a school day, and then my kids came home from school. So we didn't want them to know what was going on yet, because again, I've just been diagnosed. I don't know what my treatment is. I don't know what's going to happen. So we kind of put on, like a fake smile on our face and went around on with, our regular day. It was almost surreal. I mean, I have to say, I mean, I literally don't remember a lot about, those, few days. It's all a blur because I was just trying to process everything, and I was very upset and crying tons, but also feeling like I wanted to hide that from my kids. So it was kind of a crazy time. It really was.
And yeah, I cannot even imagine having to juggle all of these different sort of, balls in your life. So I have a couple more questions before we move on to the treatment section of your story, which will be the next video. Ivy, I know that you did get tested for different mutations. Can you describe how quickly that happened? Was that after you met with a thoracic oncologist and she mentioned, this is what we need to do to figure out exactly what the treatment will be? What was that like?
Yeah, no, it wasn't like that. What ended up happening, I didn't know this, but I guess once they had determined that it was lung cancer, my hospital automatically, and this was at Northwestern downtown, automatically sent my sample for molecular testing. And since this was back in 2013, they didn't test for as many things as they test now, but they tested for EGFR, ALK, and KRAS. But I didn't know any of that was going on until I got a call from the nurse who works with my new thoracic oncologist, who I hadn't even met yet because my appointment wasn't going to be until January. And I think she called me a couple of days before. And she told me, she basically, was calling and getting my information. She said to me, and let me ask you this, has anyone, talked to you about molecular testing? And I said, well, no, I've actually done some reading about it because, I had, but, she said, well, I want to let you know that you have an EGFR mutation, and that's actually a good thing because we have, drugs and medications that you can take that can, target that in their oral pills. And she started explaining it to me. And this is before I even met my thoracic oncologist. So that, well, I can't say that it completely calmed me down and made me feel like there was some hope. And it also kind of changed completely how I was thinking my treatment would be, because I initially thought, as a regular person who doesn't have a background in science and oncology, I mean, I had never heard of targeted therapy. I mean, I thought that my treatment was going to be what you think of when you think of someone with cancer. You have chemotherapy, you lose your hair, you're sick. But I found out from her that it was going to be a very different type of treatment. So
Yeah.
that was kind of the one bright, kind of ray of sunshine that, kind of clicked in before I actually met my oncologist.
Yes. I mean, and at that point, any bit of good news, right? I mean, it was such news that it turned out there was going to be a plan, because there was medication, there was a targeted therapy, there were drugs that you could take, and specifically for EGFR. And so one of my last questions here too is, I know it sounds like you felt like the process had been good so far at Northwestern. Had you considered a second opinion, or did that ever cross your mind? And do you have any guidance for other patients and caregivers about this topic?
At this point, no, I did not consider a second opinion. I actually even spoke to, I was introduced through mutual friends to someone who lives 20 minutes away from me, maybe not even that far, in the Chicago suburbs, who's also living with lung cancer, a woman about my age, but who had been diagnosed, a few years before me, and is very involved in advocacy. And I talked to her right after I was diagnosed, and she was the one who told me about mutations and targeted therapy. So I kind of had somewhat of an idea of what molecular testing is when I spoke to my oncologist nurse. But she had also told me about who some of the best thoracic oncologists were to see in the Chicago area, and even helped me get an appointment with Dr. Patel at Northwestern, who was my oncologist. So I felt very, very good about the person I was seeing.
Okay. Okay, great. Thank you so much for sharing that. We're gonna now segue into the second video, so stay tuned. And Ivy's gonna talk about two different targeted therapies she underwent, and one still taking, and also eventually surgery, right, Ivy?
Mm-hmm.
Okay, perfect. Okay, so hang tight.